Hello esteemed viewers, you're welcome back to my channel. I'm Famlola, a community pharmacist in Lagos, Nigeria. Thank you so much for liking, watching, sharing, subscribing on my channel. Today we're not going to be talking about any health condition in particular, but I'm basically going to be talking about the experiences in community pharmacy for me, and I'm sure that most of my colleagues can also relate. And it's also a call of appeal, so that if you are a patient or a client watching this video and you are guilty of one or more of these offenses, you should please make amend in the coming year. So let's watch this video, let's talk about these things, and then at the end we'll also share our opinions and view on which of these we experience or which of these we are guilty of. Yes, I'm going to be shaking some tables today, so let's go right into the video. Thank you. First off, I want you to understand that if your pharmacist asks you if you're pregnant, you're breastfeeding, you have stomach ulcer, are you hypertensive, are you diabetic, these questions and many more, when being asked, it does not mean that we are intruding on your privacy. It does not mean that we want to use you to catch crews, so to say. It does not mean that we just want to know for fun's sake. Please, it is in your best interest, because even as at yesterday, I had an encounter with a client. He came in for pain medications, so just asking, do you have stomach ulcer? And he flew up that it's in be your own, give me drug. He asked me whether I get ulcer, which kind thing be that. And he said a lot. He said more than this. Actually, he was angry and he walked away, and I'm like, do they think we are asking them out, or are we seriously? I don't want to sound harsh in this video, but these are the things we experience almost every day in the community pharmacy. Even earlier yesterday to a woman, I wouldn't know if she's 60 or not, but she's a woman, a female, and I was dispensing drugs, and I asked her that, okay, are you pregnant or breastfeeding? She was like, Emike, grandma. See, pregnancy or breastfeeding, it doesn't show on the face, they show for face. So please, when we ask you, we are not just asking you jam questions in quotes. We are asking you because of the medications that we are dispensing to you. When you are asked yes, no, yes, no, people will say, I don't know. Okay, if you don't know, am I the one that will know if you are pregnant or if you are breastfeeding? So on to the next one. As you already know, your pharmacist is your drug expert. Like, you cannot know your drugs better than your pharmacist, no matter the amount of Google you Google, no matter the amount of research and all. Like, you're not a pharmacist, because pharmacists go through the rigorous training and everything to understand your drugs, the pharmacokinetics, pharmacodynamics, the mechanism of action, and everything that relates to your drugs. So I'm saying this because most times some patients come to the pharmacy with a pack of a particular drug, let's say it's a supplement or just a routine drug. So your pharmacist will tell you that, okay, this particular one, this particular company product is not available, but we have another product, like another company's product, that contains exactly the same thing with this, if you wouldn't mind. And then you're like, okay, let me see. So on bringing the drugs and showing that, okay, this is an alternative, like it contains the same thing but just from different companies, and then you as the patient, you want to do, let me see, then you collect, look at it, then you're like, but this one, they not write the same thing now. This one is red, this one is blue. See, we are not in the pharmacy to pick beans, we're not in the pharmacy to cut fish. Like, we are there because we are approved to be there, because we are certified, so to say, to be there. We telling you that it's the same. We seriously, I don't know how to go about this, but that's the simple truth. The thing is that pharmaceutical companies, they have a nickname, so to say, for their drugs. In practice, we call it brand names. So these brand names are the names the company just puts, but the drugs all contain, okay, not all the drugs, but the drugs in the particular class, they actually contain the same active ingredient, and that is what we look out for as a pharmacist. So you shouldn't just be looking at the color. So people even have problem with the quantity. They say, ah, but this one is 3 inside, this one, why is it 5? My sister, companies have different packaging techniques, packaging procedures to their products. So, and in on no occasion will any pharmacist force you or hold you and choke you that, ah, you must buy this product. I've not seen it, and I don't know if some do it, but to the best of my knowledge, we do not force you. We explain to you, we tell you the benefits, we tell you the price range and all that. So it's not left for you as the client to decide, because it's your right. What I'm saying in essence is that if you bring a drug to the pharmacy and you know that this is the particular one I want, I don't want any other color or any other product, from the onset, please say it so that you can possibly go to the next pharmacy to get it than you stressing or telling us to bring it, let me see. And as a matter of fact, most patients, they see with their hands. I'm sorry for that, but like, they are saying, let me see, the drug is in front of you, see it now. They'll say, make I see now, make I see now. Is it with your hands you see? Please, please, and please, 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 you understand? It's not also good to always touch. By the time you touch everything and you don't get any, you understand? So you won't contaminate the product, so to say. So please, 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 if you know that that's the particular one you want and they said they do not have this, in your best interest, just like they are, go to the next one from then you also get, or you ask that, okay, oh, can you get this particular one for me, and then we'll make way to source it out for you. So that is that about that. So the other class of patients we experience in community pharmacy are those that are always in a hurry. Possibly they are on their way home, or they are on their way out, they are in a cab or they are on a bike, and then they stop. And not like they are stopping to ask that, okay, give me vitamin C syrup, let me buy and go. No, they want to see the pharmacist and they are also in a hurry. Please, who does that? Oh, wrong now. It's not supposed to be so. You ask the pharmacist comes and you talk, you complain. Most times, even complain, no. They lay their complaints, you bring out drugs, check for interactions, check everything, balance everything. And then at the background, they're like, be fast, the bike is waiting for me. Ah, it's not supposed to be so. Please, please, from this coming year, please, let's do better. Because most times we go to the hospital, we spend so much, like we spend so much time, money, time and everything. When it's time to get your drugs, just feel that it's just one random person sitting there, let it just give you, let me go. Drug dispensing is not all about the money. We have to counsel you, we have to tell you what to do, when not, what not to do, when to take, when not to take. So it's not a rushing matter. It's not like we are selling bread that if we make a mistake and give you a big size, small size, nothing will happen. We have to calculate, we have to check for interactions. We have to give you adequate pharmaceutical advice and care. So please, if you are in a hurry, I would suggest you go to where you are going. Then on your way back, you will come there and settle in. I'm not saying we're going to take your whole day, but depending on your case, depending on the medications you are getting, we have to double check and cross check and just make sure we give you the right thing for your disease condition, and also follow up with you. So that's that about that. Another set of people are those who come to the pharmacy. This thing about drugs, even as little as paracetamol, it comes in different forms. We have the tablets, we have the injections, we have the syrups, we have the drops. So please, Bikono, I'm pleading, Ejo, when next you come to the pharmacy, don't just say, I want to buy paracetamol, and you're looking at us, okay? Seriously, please be specific, because you don't expect us to know that, okay, this person is injection you want, and we'll it's not possible. Just tell us, okay, I want to get paracetamol drop. We bring it for you. Even as little as, even as when you simplify, there are still many options, but at least you've broken it down for us. So if you want a drop, we'll bring the one from different companies, show it to you. Which one do you want? Rather than you saying, give me vitamin C, and you're looking at us. Vitamin C what? Is it the tablet? Is it the syrup? Which of the vitamin C? Please, please, let's do better in this coming year. Let's do better in this coming year. I know we are all trying. Like, I salute and commend you all for that. Like, you're amazing. But please, let's do better. And another thing is that when next you come to the pharmacy and you say you're not feeling fine, please also say your symptoms. Like, tell us how you feel. Tell us how you feel. How is it? Is it headache? Because if you're having a headache, me looking at you, we might suspect, but it's not like you. It's not like you that the thing is happening to. So when you say you're not feeling fine, don't just look at us and be like, we are not magicians. We are humans. So we have to rub minds together. So based on your symptoms and then the signs we see, also be able to give you the right diagnosis and all that. So I think basically that's all. That's not all, but that's all I'll be talking about in this video, because community pharmacy is a place to be. Like, it's so fun. Like, you see a lot of people, a lot of cases, and all that and all that and all that and all that. Thank you so much for watching this video. Let me know of any other one I forgot to mention, because if I start to talk we might not end this video even up till 24 hours later. So just let me know in the comment section below the ones you've experienced in your community pharmacy, or if you are a client, what you think we should also do better, or the places you feel we are also lacking. So we'll learn together and do better together in the coming year. Thank God for the year 2021. It was awesome with you all. Thanks for your support, your views, your likes, your comments, and your subscriptions. Thank you so much. I'm so grateful. I still remain Famlola, and by the grace of God, I'll be seeing you in 2022. Seeing you and yours. Thank you so much for everything. I love you all. Don't forget and always remember that, let's say it together now, good health is true wealth. See you soon.